Good morning.
Morning.
My name is Rudy. I'm going to be your nurse today. We're going to be doing a head-to-toe assessment. Would you please tell me your full name
Rufus Tekai,
and your date of birth?
042468.
Excellent. And how would you like to be called today, Rufus?
Rufus.
Rufus? Excellent. And can you tell me how you got here today?
I drove.
You drove here? And where are you?
I'm in the hospital in Burlington, Northwestern University.
And do you know what day it is?
Today is a Monday.
It's a Monday.
Yeah.
Excellent.
Thank you.
And who is the President of the United States?
Donald Trump.
Donald Trump, he is. So we're going to take a look at you, and as I see right now, your skin tone appears normal, and you're breathing well and answering my questions. Do you have any pain?
No.
No pain. Do you have any other things or complications that you've been aware of?
Not right now.
Okay. Well, I'm going to start up at the top of your head, and we're going to just kind of work our way down and see what we can see, okay?
Okay.
So I'm going to start by just looking at your hair and checking your head for any lesions. All looks normal, good symmetry, good hair, full hair distribution. And I'm just going to kind of reach down. I'm going to actually feel the for any your lymph nodes for anything. We're going to start back at the occipital lobe, and I'm feeling for any abnormal sizes or hardness, but it all feels nice. We're going to do the posterior auricle, the pre-auricle, parotid, the tonsillar, submandibular, submentum, the post-carotid, the supraclavicular, no abnormal findings. Okay, I'm just going to take a look at your ears here. I'm going to feel the auricle of the ears. And any tenderness?
No.
No, I'm going to feel back here. Any tenderness?
No.
All right. And can you just lift your shoulders for me? Excellent. Beginning our test of our cranial nerves here. And we're going to just continue with that, looking at your eyes. So I'm going to test, and if you could look straight ahead, and just look at a point just behind me there on the wall. And we're going to look at pupils. They appear round and equal. So I'm just going to bring this light across. Just keep staring out over there. So we have reaction. Yeah. Both pupils constrict in the presence of light and then return back. Can you just stare at this straight ahead for me? I'm going to bring that forward. Just follow this and I bring it forward. Excellent. And then you're going to follow it. I'm going to take it around, up in a box, all right? And just follow this point. Excellent. So cranial nerves 3, 4, and 6 are working. And then I'm just going to look for corneal reflex. So just stare straight ahead. And we have an equal reflection in both eyes right there in the pupil. Excellent. I'm going to look at your nose. Have you been able to feel like you're breathing through both nostrils?
Yes.
Excellent. So nostrils seem patent. And could you open your mouth for me? Stick out your tongue. Excellent. Mucous membranes seem pink and moist. Say ah.
Ah.
Excellent. Yeah, tonsils are present, but not swollen, not touching. Good. Everything looks good there. I'm just going to check, and I'm going to feel your carotid pulse. I'm going to feel your pulse on this side. Both pulses are present. And then just raise your arms for me. Excellent. So, arms feel strong. And then turn around. I'm just going to check pulses. both radial pulses are present and equal. And then just push against my hands, excellent. Grab my thumbs, hold my thumbs, excellent. Good bilateral strength and grip strength. Go ahead and you can set your arms back down. Okay, I'm going to listen now to your lung sounds. So just take some deep breaths for me. So go ahead, breathe in, breathe in. I'm expecting to hear bronchial sounds, which are going to have louder expiration than inspiration. And breathe in, breathe in. Now I'm hearing more bronchial vesicular sounds where the inspiration and expiration are more equivalent. Breathe in, breathe in. And then we're going to listen over here. Breathe in. Right here. Breathe in. Breathe in. Breathe in. Excellent. And I'm hearing more vesicular sounds where inspiration is going to be louder than expiration. So now if you could turn around for me. Just going to listen to the 8 points on the back. Deep breath. 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 Excellent. All sounds are present. I'm just going to palpate here and just go ahead and take some nice easy breaths for me. And now take a deep breath in. I'm watching for symmetry, good spread. All right. I'm just gonna do a test of your kidneys. So I'm gonna thump on your back here and you tell me if you feel any pain, okay? Feel any pain?
No pain.
All right. Any pain?
No pain.
Excellent. Go ahead and turn back around for me. All right, so we're going to listen to heart sounds now. So I'm going to start at the second intercostal space, right sternal border, listening for aortic sounds. And I should be hearing S2 is louder than S1. And then we move over to the second intercostal space, left sternal border for the pulmonary artery. And again, S2 will be louder than S1. Moving down to the third intercostal space, left sternal border for Erb's point. S2 will be louder than the two S1 and S2 will be equal. Fourth intercostal space, tricuspid valve. And fifth intercostal space, midclavicular line for the mitral valve. And in both of these, S1 should be louder than S2. Excellent. Now I'm going to switch to the bell. I'm going to listen to the carotid arteries for bruits. And I just want you to hold your breath for a moment. And take a breath. And then hold your breath for a moment. Excellent. No sounds there, which is what we're looking for. And then if you could lean forward slightly for me. And we're going to listen again to our locations of the aortic, pulmonic, Erb's point, tricuspid, and mitral with the bell for bruits. Excellent. No abnormal sounds. Heart arteries sound good, and S1 and S2 are audible as they should be. So now If I could get you to just lay down for me. And I'm just going to palpate and feel the aortic, the apical pulse. Do you have any pain?
No.
Okay. So now we're going to move on to the abdominal assessment. And in visual inspection, I'm looking for good symmetry, no presence of any abnormal distension. And I'm going to listen to the artery sounds, starting with the aorta, aortic artery, the renal arteries, iliac, and femoral. I'm going to auscultate the 4 quadrants of the bowel for making sure there's bowel sound. Bowel sounds are present in all 4 quadrants. I'm going to percuss. Listening for resonance and making sure that over the abdomen I don't hear any dull sounds that could indicate obstruction. Sounds seem good. I'm going to just palpate gently. Do you feel any tenderness?
No.
No tenderness. Abdomen is soft and non-tender. Excellent. I'm going to move down to your legs. So just go ahead and stay there and just bend your knee for me. Excellent. And just kind of push against my hand. Excellent. Let that one come back down, same thing. Push against my hand. Good. Legs are strong, muscles are bilaterally equivalent. Moving down, we have capillary refill. I'm going to assess popliteal, or popliteal pulse is present. Dorsalis pedis. And posterior tibialis. Posterior tibialis. Excellent. And then I'm just going to have you push against my foot for a second and let it go. Excellent. We're just assessing dorsal reflex. Push against my foot. Excellent. All right, now sit up again for me. We're just going to check one more reflex here. Anything else? Have you noticed any tenderness throughout this exam?
No.
Excellent. All right, so we're just going to check the reflex. Excellent. The reflexes look good. Do you have anything else that you had concerns about or questions about?
No?
Excellent. Well, I've